This is treatment for an innominate flare and rotation using direct myofascial release with active range of motion assist. So you're going to be on the same side as the dysfunction, so I'm going to be working on his left side. And so I'm going to be feeling the innominate. I'm going to have him bring his knee up, bend it out towards me, and just hold it there. I'm going to apply just enough pressure on the knee so that it does not pop up when he's sliding his knee down. And then with the hand monitoring the innominate, I'm going to push it where it does not want to go. So if it's an anterior rotation, I'm going to push it posteriorly. When I reach 3, I want you to straighten your leg as fast as you can so that it's straight and next to your other leg. 1, 2, 3. This is BLT for the sacrum. So the sacral segments may not be completely fused, or they may be intraosseous strains causing each of the individual segments to act differently. So what you're going to do is just find the sacrum and work your way down, diagnosing each part. So start at S1 and then work down to S2, see if it's rotated a certain way versus the other ones. And so for him, his S2 is rotated to the right, which means that this side is sticking out more towards me. And so since BLT is an indirect technique, we're going to want to push it more to the right. So I'm going to keep my left thumb on the segment, and then I'm going to find a segment that is not as rotated, and that's going to be my monitoring hand. So I'm going to keep my right thumb on S4, and so I'm going to push until each of the segments feel like they're pushing against me equally. So the pressure on my left thumb is the same as the pressure on my right thumb, and I'm just going to hold that until I feel the release, which to me just feels like the tissue is just spreading away. And so then I'm going to go back and recheck S2 and see if it is less rotated to the right and back into a more neutral position. This is facilitated oscillatory release for any sort of sacral dysfunction. However, just a warning that it may not treat posterior sacral torsions. So what you're going to do is you're going to put your caudad hand or your bottom hand on the sacrum to monitor it. And then your other hand is going to be on the ribs, and you're going to just push inward to induce a wave down into the sacrum, and just keep doing that until you feel a release in your hand that is on the sacrum. And then once that is over, then you're going to recheck the diagnosis.